Hi, I'm Dr. Ritika Goyal. I'm a pediatric pulmonologist, allergy, and sleep medicine specialist in New Delhi. Let us today understand that why is sleep so important for our children and even for adults, and how do we ensure that our children are sleeping well. This is where the role of sleep hygiene comes in. So let us discuss this in detail. So, sleep is a normal physiological process by which the body tries to restore its bodily functions. In simple terms, how we reboot our computers or our machines so that they function properly, the same way the body reboots itself so that it can work to its maximal efficiency the entire day. This sleep is extremely important for normal growth and development of our children. More importantly, sleep is when all the important neurological functions develop and mature. That's why it's extremely important that our kids get a good quality sleep and adequate duration of sleep. In general, sleep is divided into two phases: the active sleep phase, which is the REM phase, and the quiet sleep phase or deep sleep phase, which is the non REM phase. While both the phases of sleep have their individual functions, both are equally important to restore bodily functions. While the quiet sleep phase is mainly restorative, that is, it is involved in restoration of bodily functions, the active sleep phase is involved in complex neurological functions like consolidation of memory, emotional and neurological development of the brain, and other important higher functions. There is an increase in the non REM phase and decrease in the REM phase in the first 2 years of life. As the child grows older, by 2 years of life, the sleep architecture resembles that of an adult individual. Duration of sleep keeps decreasing as the child grows up. For example, a newborn might sleep for 19 hours and that is normal, but an infant needs around 12 to 14 hours of sleep per day. As the child grows, a toddler requires around 9 to 13 hours of sleep per day, while a preschooler up to 5 years of age requires 8 to 10 hours of sleep per day. For normal sleep, both the duration of sleep and the quality of sleep are important. If the child is not completing his sleep or is sleeping for lesser duration than what is required, then the body keeps going into what is known as a sleep debt. And as the sleep debt builds up, the body starts showing signs of daytime sleepiness or tiredness and leads to poor performance in school and decreased alertness throughout the day. These things can be detrimental for normal behavior and for mental growth of the child. On the other hand, the quality of sleep is also extremely important. By quality of sleep, I mean sound sleep that is regular, without any arousals. Fragmentation of sleep, that is breaking of sleep every now and repeated arousals, leads to poor quality sleep. Children with poor quality sleeps are known to have sleep related problems like night terrors, sleepwalking. These are all related to poor quality sleep. One of the most important cause of poor quality sleep is obstructive sleep apnea, and this is the most common cause of poor quality sleep in children. What happens in obstructive sleep apnea is that during sleep there is some amount of obstruction in the airway, and as a result the child is not able to breathe while sleeping. This leads to oxygen desaturation and arousal. By arousal, I mean the child may not be fully awake, but the sleep breaks. The sleep architecture is disturbed. Obstructive sleep apnea can have some really serious and dangerous implications for your child. So we must diagnose it and treat it at the earliest. The most common sleep problem that we see in infants is the behavioral insomnia of infancy. In simple terms, behavioral insomnia of infancy is just when the child doesn't learn how to self-soothe or go to sleep on his own. At the end of one sleep cycle, all infants and babies, they wake up. And most infants who are trained properly can go back to sleep without needing any assistance. To ensure this kind of behavior, we must let the children self-soothe. Some of the things that the infants do to self-soothe is they suck their thumbs or they try to put everything in their mouth, because for them, their mouth and tongue is a very important sense organ. Another important thing that parents can do is associate some activity with sleep, and that these have to be positive associations. For example, some children fall off to sleep while listening to music, or they like to grab onto a toy or a blanket when they're trying to sleep. These are all positive associations. Some of the associations that must not be encouraged or the child should not be put into a habit of is cuddling, maybe rocking, and even feeding to sleep. We must not feed them to sleep in infancy, because then that becomes a habit. Sleep hygiene practices have been laid out by the international societies, and they must be followed to ensure good quality sleep in children, adolescents, as well as adults. Here are the 10 points of sleep hygiene that we must follow. Have a set bedtime and bedtime routine for your child. Bedtime and wake up time should be about the same on school nights and non school nights. Make 1 hour before bedtime a quiet shared time and avoid high energy activities during that time. Don't send your child to bed hungry. A light snack before bed is always a good idea. Avoid products containing caffeine or other stimulants before bedtime, like caffeinated sodas, chocolates, tea, coffee. Make sure your child spends time outside every day and is involved in regular exercise. Keep your child's bedroom quiet and dark and at a comfortable temperature. Don't use your child's bedroom for timeout or punishment or any other negative association. Reduce screen time during the day. It is recommended that children watch not more than half an hour of supervised television in a day. Make sure that your child goes to the washroom before sleeping. This will avoid any arousals during the night and also help you in potty training. Remember that happiness is a sleeping baby. Follow these steps and you will see a change in your child's sleeping pattern.